And summing up against the proposition, Michael Cannon, co-author of Healthy Competition, What's Holding Back Healthcare and How to Free It. He is the Cato Institute's Director of Health Policy Studies. Michael?
At the reception before we came in here, I was standing across from a man who was reading his program, and when he came to the part with my picture on it, he looked at the picture, he looked up at me, and he said, "Hey, that's you." And I said, "Yes, that's me." And he said, "You're against universal coverage?" Because I think, and this look came over his face, the question that was forming was something like, what kind of a moral reprobate could be against universal health insurance coverage? And I know that I have a lot of family here tonight who are asking themselves the same question. My opposition stems from two beliefs. One is that people should have the right to choose their doctor, they should have the right to choose their health plan, and those things are often lost in systems of universal coverage, almost uniformly. No, I think totally lost. And second, universal coverage is not going to make us healthier. We have serious problems here in the United States with rising costs, with low quality care, and we have health plans in the private sector that are trying to innovate with ways to reduce those costs and to improve the quality of care. The only problem is you can't choose them because the government has said you can't. The only problem is that the government controls half of the money in our healthcare sector. And so the industry is able to block those innovations because they want to protect their incomes. You can have a healthcare sector that guarantees universal coverage, or you can have a healthcare sector that continuously makes medical care better, cheaper, and safer, making it easier to deliver on that moral obligation that we have to help the less fortunate among us. You cannot have both.
Thank you, Michael Cannon. Finally, the last word goes to Art Kellermann. Art Kellermann is not a surgeon, as I incorrectly said before. Art Kellermann is an ER doctor at Grady Memorial Hospital in Atlanta and a professor at Emory. Summing up for the motion, universal health coverage should be the federal government's responsibility. Dr. Art Kellermann.
Have you all heard the expression that there are no atheists in foxholes? I can tell you, in my experience, there are no libertarians in intensive care units. It's widely said that Americans can pick their doctor. The fact of the matter is, if you're in a non-group plan or you're in a plan that doesn't contract with these doctors over here, but you can over here, every day I see patients whose care is disrupted because their plan has shifted doctors, they didn't get the deal they wanted. We've surrendered an enormous amount of freedom in this country to the private insurance industry and to the rest of the industry. We can collectively together do better. In just a few moments, you're going to vote again. And the six of us care a lot about how that vote turns out. But that's really not the vote that matters. The vote that matters is coming up on November the 4th. And I encourage every one of you to do your homework and do your homework on the candidates' positions on health care, because they are strikingly different and they, to some degree, break down along the lines of the debate tonight. And it should make a difference in the choice that you make then as well as the choice you make tonight. I want to close by going back to the bedside of that family. I didn't tell that mother the whole truth that night, but by staying silent and withholding the truth, I left her with something we both needed, which is hope. Hope that her son would beat the odds. Sometimes we see young people come back from catastrophic injuries and do okay. Hope that Georgia and every other state in this country would develop efficient, effective, regionalized trauma and emergency care systems so everyone can have access to life-saving emergency care. And most important, hope that this great nation of ours, the United States of America, will soon finally do the right thing and cover the uninsured, so no mother need ever ask again, will my son get the care he needs? Please vote for tonight's resolution.
Well, we're done, but for your part, but this was a really terrific debate, and I want to just, for all six, this isn't just Art's applause now, for all six. So pick up those voting keypads. You may recall that when you came in here, 49% of you were for the motion that universal health coverage should be a federal responsibility. 24% of you were against, and 27% of you were undecided. So you can begin the voting process, which you seem to have gotten down the first time quite quickly. Before we go to the results, I just want to thank the panelists and especially all of you in the audience, because the questions were first rate and moved the discussion into interesting places. I want you to also know that our next debate will be Tuesday, October 7th, 2008. The motion is going to be America is finally winning the war in Iraq. Finally, we are pleased to announce that our December 2nd debate, where the motion is Bush 43 is the worst president of the last 50 years, will not voting now, please, will be recorded for broadcast on BBC World News Television. To accommodate for that taping, we will be moving the debate to a larger space, Symphony Space Theater at 95th and Broadway. This means that there will be more seats available. A limited number of tickets will be made available. And now to the results. Question of who won the room before the debate. For, 49%, against 24%, undecided. After the debate, 58% are for the proposition, 34% against, 8% undecided. Thank you very much, everyone, for joining us this evening.